Gracias por
Good morning,
acompañarnos.
everyone, and thank you
Estamos
for being with
abriendo
us.
la sala,
We are
así
just
que
opening up the room,
aguardaremos
so
unos
we will
minutos
just wait a couple
para
minutes
facilitar la conexión de todos los
so that
asistentes.
all our attendees can join.
Muchas gracias por su
And thank
paciencia.
you for your patience.
Muy buenos días, bienvenidos y bienvenidas a todos
Good
a esta
morning. Welcome,
sesión de hoy.
everyone, to
Mi
today's
nombre es
session.
Claudia Pechetto, soy
My name is
asesora en
Claudia
Economía y
Pacheco.
Financiamiento de la
I'm a
Salud
counselor in
WHO
Economy
de
and
la
Finance for
OMS
Health
regional.
for PAHO
Y durante la
WHO
próxima hora
regionally.
y media tendré el
And
gusto
in
de
the next hour and a
acompañarlos
half,
como
I will
moderadora de
be
este
delighted to
seminario
join
virtual.
you as moderator for this
Este es el
remote
segundo
webinar.
webinar de una
This
nueva
is the
serie
second
sobre
webinar in a
atención
new
primaria en
set
salud
on
con
primary
perspectiva
healthcare
territorial,
attention with a
una
territorial
propuesta
perspective,
que retoma las
a
experiencias de la
proposal
serie
that
sobre opciones de
resumes
política,
experiences on the
resiliencia y
series
apoyo
on
APS que
policies
hemos
for
impulsado
resiliency and especially APS that we have
desde el
been
2022
organizing
y
since
continuamos el año
2022.
pasado y ahora
This
esta es
carried
nuestra
on last
segunda
year, and now
edición.
this is our second
En este
version.
segundo evento
For this
hemos
second
decidido
event,
abordar
we
un
have
eje
decided
central
to tackle a
como lo
central
es el
point,
financiamiento de la atención
such
primaria
as
de la salud
funding
y
of
la
primary
priorización de
healthcare
la
attention and
APS
prioritization of
en el gasto
APS
público en un
in
conjunto de
public
países
expenditure in a
seleccionados,
set of selected
retomando
countries,
las experiencias de este webinar,
resuming or taking the experiences from
titulado
this webinar
Financiamiento de la
entitled
atención primaria y la
Funding of
atención
Primary
integrada de
Healthcare
salud,
Attention and
retos y
Comprehensive
oportunidades.
Healthcare Attention
Este
Challenges and
evento nos dará
Opportunities.
también la
This event
oportunidad de
will also give us
presentar
the
y compartir
opportunity
con
to present
ustedes
and to share
nuestra
with
más
you
reciente
our most
publicación sobre este
recent
tema,
publication
el
on this
reporte
matter,
titulado
the
Análisis del
brief
desempeño
titled
presupuestario del
Analysis
sector salud
of Budget
en el
Performance in the
periodo
Healthcare Sector in the term
2019-2021.
2019-2021.
Queremos contarles también que
We want to
contamos con
tell
un
you
grupo de
also that we
destacados
have a group
panelistas invitados
of
a quienes
distinguished
agradecemos
panelists and
muy
guests
especialmente por haber
whom we
aceptado
especially thank for having
acompañarnos en esta
accepted
oportunidad
being with us
y a
at this
quienes
time,
iremos
and
presentando
that we will
brevemente.
begin presenting
Pero antes de dar
as
comienzo,
the
quiero
time
comentarles
comes.
que
But
como
before
es
beginning, I
usual
would
en
like to
nuestra
tell
serie
you that,
de
as is
webinars,
usual in our
estaremos
series of
ofreciendo
webinars,
interpretación
we will be
simultánea
offering
en inglés,
simultaneous translation
español y
into English,
portugués.
Spanish, and
Así
Portuguese.
que le pedimos que por favor elijan
So we
el
ask that
idioma
you
de
please
su
select
preferencia.
the language of
Para
your
hacerlo,
preference.
deben presionar
To
el
do so, you
botón
must
en forma
select
de globito en la parte
the globe
inferior de la
icon in the lower
pantalla
part of
de
your
Zoom.
screen.
Contamos también con
We also
interpretación
have
simultánea al sistema de
simultaneous
signos
translation
internacionales que ustedes
into
podrán ver
international sign
en
language that you
pantalla
can
durante
see
toda
on
la
the
actividad.
screen during the
Por
whole
favor, tengan en
activity.
cuenta que pueden
Please
enviar
note
todos sus
that you may
comentarios en
submit
cualquier
all
momento
your
durante
remarks at
el
any time
seminario
during the
a
seminar
través del chat. Y
by
por
making
último,
use of
les
the chat.
recordamos, sobre todo
And
a los
last,
colegas
we remind
panelistas y en la
especially to our
organización, que
uh,
mantendremos nuestros
panelist colleagues
micrófonos
and in the
apagados para
organization to
poder
keep your
facilitar el
microphones
desarrollo
off
de la actividad y
in
evitar
order to
interrupciones.
facilitate the development of
Y
the
sin más que
activity without
agregar, para
interruptions.
dar
And without
inicio a
further
esta
ado, to
actividad,
begin this seminar,
tengo el gusto de dar el
I have the
paso al
pleasure
doctor
of
Ernesto
handing the
Báscualo,
floor to
jefe de
Dr.
la Unidad
Ernesto
de Atención
Bascalo,
Primaria
Chief
de
of the
Salud y
Primary
Prestación
Healthcare
Integrada de
Unit
Servicios
and
de
Holistic
la
Provision of
OPS.
Services of
Adelante, Ernesto,
PAHO.
muchas gracias
Go ahead,
por
Ernesto, and
acompañarnos.
thank you so much for being
Gracias,
with us.
Claudia.
Thank you,
Muy
Claudia,
buenos días a
and
todas y
good
todos
morning, everyone.
y fundamentalmente gracias por conectarse a este webinar.
And basically, thank you
Esta
for
es
joining
la
this
segunda
webinar.
actividad de la
This is the
serie que
second activity
comenzamos
in
el
the
mes
series that
pasado,
we
lo
kicked off
presentaba
last year,
Claudia,
as mentioned by
con una
Claudia,
conversación en ese momento sobre
with a
políticas y
conversation at that
estrategias de
point on
calidad en
policies and
salud,
strategies for
en la
quality
que
in healthcare,
señalábamos
where
en
we
ese
pointed
momento
out
los
at that time
avances y también
advancements, but
aprendizajes en los
also
países
learnings in the
sobre
countries
sus
on
propios procesos
their own
de crear
processes
políticas
to
nacionales
set up
que
national
trasciendan los
policies which
gobiernos y
transcend
construyan en una
governments
forma
and are built
participativa,
in a participatory manner
incorporando la
by
diversidad de sus
incorporating the diversity of their
territorios, porque
territories. And once
el
again, the
adjetivo
adjective
y la dimensión
and
central
the
del
central
territorio como
scope of the
un tema central
territory as
de nuestra serie de
the
APS.
main issue
Y este
of our APS
mensaje tan
series.
relevante para el
And this
desarrollo
such
que en su
relevant
momento
message
fue el de
for the development, which at its
territorialidad,
point was
es
on
igual de
quality
relevante
policies,
y
is
vigente para
just
la
as
discusión que
relevant
tendremos hoy.
and timely for the
Es por
discussion
eso
we're
que hemos
having today,
construido una
which is why
serie
we've
en
built a
torno al
series
desafío de la APS
surrounding the
en el
challenges to
territorio, en
APS
la
in the
cercanía,
territory,
en ese día a día
in
de
that
muchos de
day to
ustedes que
day
están conectados,
of many of you who
que
are
muchos de
connected,
ustedes trabajan no
given
solo
that many
como
of you are
profesionales,
working not only as
como
professionals
equipos de
and
salud
as
en
healthcare
distintos
teams
espacios a nivel
in many
de los
spaces
ministerios, a
at the
nivel
level of ministries
de los
and
espacios de gestión, de las redes de
management
servicios de salud.
spaces and
Nosotros
the healthcare
entendemos que una
services
mirada
networks.
territorial
We
en el
understand that a
enfoque de la
territorial
atención primaria
perspective
de la salud
under the
en la
scope of primary
región
healthcare
es
attention in the region
fundamental. Y
is
el valor de
fundamental,
esta
and
serie
the value of these
está en
series
definitiva
is
en
definitely
articular el conocimiento y
in
la cooperación
articulating the knowledge
técnica
and the
con las
technical cooperation
experiencias concretas
with
de los
the concrete
países en la
experiences
región.
in the
Por eso,
countries in the region,
en esta
which is
segunda
why
actividad
in this
queremos
second
reflexionar
activity we
desde
would like
las
to reflect
experiencias
from
y
the
sobre
experiences
los desafíos
and
concretos
on
que
the
tenemos
concrete
en
challenges
la
that we have
diversidad de
in
situaciones, de
a diversity of
casos,
situations and cases
en los países que vamos a
in
estar de
those
alguna forma
countries
abordando
we'll be
en la
tackling
presentación
somehow
del día de hoy. Por
during
ello,
today's presentations.
eh,
This is
hablar de
why
financiamiento de la atención
discussing funding
primaria
of
y
primary
la
healthcare
atención
attention
integrada de servicios de
and
salud
comprehensive
es
healthcare
clave como una
services
dimensión que es
is key
crítica
as a
a la
dimension which
hora
is
de
critical
hacer
upon
realidad esta perspectiva
making
de
this
la APS a
perspective
nivel
of
territorial.
APS at
Hoy
the
tenemos
territorial
una
level a
agenda que
reality.
involucra
Today we have an agenda which
diversas
entails
voces de la región
or involves
sobre
many
un tema que
voices in the region
resulta
on a
crítico
matter that
para
is critical
avanzar hacia el fortalecimiento de los
to
sistemas de salud.
progress through the
Tendremos la
strengthening of healthcare
oportunidad de
services.
compartir con
We'll have the
ustedes
chance to
una de
share with you
nuestras
one of
recientes
our
publicaciones,
recent
el reporte
publications,
titulado, como lo
a report
planteaba, como lo
entitled,
mencionaba
as
previamente
was mentioned
Claudia,
previously by Claudia,
Análisis del desempeño
analysis of
presupuestario del
budget
sector salud
performance
en
of
el
the
periodo
healthcare sector in the term
2019-2021,
2019-2022,
con resultados de diversos
2021, sorry,
países, de
with different
Chile, de
outcomes in
Colombia, de
many countries:
Guatemala,
Chile, Colombia, Guatemala,
Honduras,
Honduras,
Panamá,
Panama,
Perú, República
Peru,
Dominicana
the
y
Dominican
Uruguay.
Republic, and
El
Uruguay.
reporte que será
The
presentado por
report, which
Claudia,
will be presented by
ofrece una
Claudia,
mirada sobre
offers a view
el alineamiento
on
entre la
alignment between
priorización del primer nivel de atención
priorization of the first
y el
level of attention
desempeño presupuestario.
and budget
Un
performance.
informe más que oportuno
A report which is more than
para
timely
completar el
to
análisis
fulfill
sobre
the
la
analysis
respuesta a la pandemia
on the response to
COVID-19.
the COVID-19 pandemic.
Hay muchas lecciones para
There are
aprender
many
de esta
lessons to
publicación
learn
y de las
from
discusiones
this
que hemos tenido
publication and the
oportunidad de
discussions we've
avanzar con
had
nuestros socios
the chance
estratégicos
to
sobre la
advance with our
necesidad de
strategic partners on the need
priorizar
to
la
prioritize
inversión en el primer
investment
nivel de
and
atención
the first level of
como
attention
un pilar
as a
fundamental
fundamental
de los
pillar
sistemas basados en la atención
of
primaria de la
systems
salud.
based on primary healthcare
Seguidamente,
attention. Next,
presentando una
and
visión de
presenting
país con
a
mayor
country
profundidad,
vision with greater
nuestro
depth,
colega Hernán nos
our colleague
presentará los
Hernan will
resultados de un
present to
trabajo
us the results from
maravilloso
a wonderful
titulado
effort
Estimación del
entitled
gasto público
Estimation of
en el
Public
primer nivel de
Expenditure in
atención
the
en
First Level
Perú.
of Attention in Peru.
Seguramente un ejemplo que
Surely, this
consideramos
is
una
an
buena
example
práctica
that
que
we
puede ser
consider a good
implementado
practice
en
that
otros
can be
países de la
implemented in other
región.
countries of the
Nos
region.
referimos
And here we
a
mean
esa necesaria
that necessary
estimación del gasto
estimation
público,
of
el
public
desarrollo de esa
expenditure,
capacidad de que
the
nosotros
development of those
consideramos crítica
capacities that we
a la hora
consider
de
critical
no solo medir,
upon not
sino
only measuring
evaluar
but also
el rol
assessing
del primer nivel de atención de
the
salud
role of the
en
first
nuestro
level
sistema
of
de
healthcare
salud.
attention in our
Tenemos
healthcare
hoy
systems.
también dos
Today,
paneles
we
de
also have
conversación
two
para
discussion
completar
panels to
estos
fulfill
trabajos y discutir
these
sobre los
efforts and to
desafíos de la
discuss
región
on the
en el
challenges in the region
financiamiento del primer nivel de
in first
Primero,
level of
con
attention
nuestros
funding.
socios de la
First,
Alianza para
with
el
our
APS, los
partners
colegas
for the
del Banco
APS Alliance,
Interamericano de
our colleagues from the
Desarrollo
Inter-American
y del
Development
Banco
Bank
Mundial,
and the
la
World Bank,
plataforma desde la que ya
the
estamos
platform from
construyendo
where
no
we're already building
solamente agendas regionales,
not
sino
only
también hojas de ruta a nivel
regional efforts,
país.
but also
Una alianza
roadmaps at the
que,
country level.
como muchos de
This is an
ustedes
alliance
saben,
which, as
busca
many of you
apoyar
know,
la
seeks to
aceleración de la
support
atención
the
primaria de la
acceleration of
salud
primary
en
healthcare
todos los
attention
países de
in
las
all
Américas
countries of
a
the
través de
Americas
una mayor
through
inversión,
greater investment,
innovación y
innovation,
acelerando la implementación de
and
la APS.
accelerating implementation of APS.
Y para completar
And
las
to
miradas sobre estos
fulfill
desafíos,
the views on these
hemos
challenges,
invitado a
we have
comentar
invited
estos informes y a escuchar sus reflexiones
people to
a
comment on these
representantes
reports
de los
and
ministerios de
so we
salud
can
de
listen to their
Paraguay,
reflections.
Honduras
Ministry of
y
Health
Chile.
representatives from Paraguay,
Desde
Honduras, and
ya
Chile.
les agradecemos a todos y
We
todas por aceptar
thank
participar
everyone
de
for
este
accepting
webinar y
to
esperamos
participate
que
in this
quienes
webinar, and we
se han
hope
conectado
that
puedan
those who
aprovechar esta
are
instancia
who have
para
joined
conocer
can make
estos
the most of this
reportes,
space to
para
know
escuchar
these
estas
reports and to
visiones y
listen to these
perspectivas
visions and
y compartir
perspectives,
también entre
and
sus
also
redes
to
en cada
share
uno de sus países.
within your networks in
Antes de
each of your
devolverle la
countries.
palabra a
Before
Claudia y
handing the floor
continuar
back to
con el
Claudia
webinar,
to carry
quiero
on with the
compartir con
webinar,
ustedes
I would like to share with you
un par de mensajes y
a couple
reflexiones.
messages and reflections.
Reflexiones que
Reflections
nacen de
which
los
are
compromisos que
born
ustedes
from
mismos
the
han
commitments that
promovido
you yourselves
desde la
have promoted
participación de sus
from
países
the
en los
participation of your
cuerpos
countries
directivos.
in
La
governing
primera es
bodies.
volver a poner
The
sobre la
first
mesa la
is
estrategia para el
putting back on the table the
establecimiento de
strategy for
sistemas
the
de salud
establishment of healthcare
resilientes
systems which
para
are
la
resilient
recuperación en la etapa posterior
and
de la
the
pandemia
recovery in later
COVID-19
stages of the
a fin
COVID-19
de
pandemic
mantener y
in order
proteger los
to maintain and
logros de la
protect
salud
the
pública.
achievements in public health
Esta
care.
estrategia,
This strategy,
aprobada en
approved
el 2021,
in 2021,
identificó algunas líneas
identified
que
some
son
lines
críticas
which are
a la hora
critical
de definir
upon defining
líneas de acción que
lines of
exigen la
action
transformación de
which
los
demand the
sistemas de salud
transformation of
sobre la
healthcare
base de la
systems
atención primaria de la
on the
salud.
basis of primary
Este
healthcare
es un
attention.
punto
This
sumamente relevante
is
para
a
todos
highly critical,
nosotros.
relevant
El
point for all of
abordaje
us,
sistémico de estos
and the
desafíos,
systemic engagement of these
incluyendo
challenges,
el
including
financiamiento del primer nivel de atención.
funding of the first
Queremos
level of
destacar
attention.
esto,
We would like
porque
to
cuando
highlight
hablamos de
this
primer nivel
because
de
when we
atención, lo
discuss
hacemos desde
the
una
primary level of
perspectiva
attention, we do
no
so from
solo
a
para
perspective which is
fortalecer
not
esa
only to
capacidad de
strengthen
coordinación de
that
los
capacity for
servicios
coordination of
por un lado
services and
territorial,
with a
sino también
territorial
un
perspective,
abordaje
but
de
only also
fortalecimiento del sistema.
engaging the
Estas
strengthening of the system.
líneas exigen también
These
el
lines also
fortalecimiento,
demand for the
obviamente, del
strengthening,
liderazgo, la rectoría y la
evidently, of leadership
gobernanza a
and
través de funciones
governance
esenciales en salud
via
pública, del
essential
fortalecimiento de las capacidades
functions
de
in public
redes de
healthcare and the
servicios
strengthening
y de
of
nuevo
capacities
del
of service
aumento
networks, of course, and
y del fortalecimiento
the
del financiamiento
strengthening
público en
of
salud, en
public
la
funding in
protección
healthcare
social,
and social
incluidas las
protection,
acciones
including
para fortalecer los
those actions to
determinantes
strengthen
sociales,
the
ambientales
social,
y
environmental,
económicos de la
and
salud.
economic determinants of
Segundo
health.
gran mensaje.
The
Como ha
second
dicho
greater
nuestro
message,
director,
as
en
has been said by our
oportunidades
director
anteriores
in
debemos
previous
redoblar nuestra
opportunities,
abogacía
we
y
must double
esfuerzo
down our advocacy and
con
efforts
un mensaje muy claro
with a very
a los
clear
tomadores de
message
decisión y a quienes
to decision
diseñan e
makers and those who
implementan
design and
políticas
implement
públicas.
public
Hay que
policies.
invertir en salud. Este
There
es el
must be
mensaje a
investment in
reiterar
healthcare. This
una
is
y
the
otra
message to
vez.
be repeated
Las
over
personas
and
más
over.
sanas
The
viven vidas más
healthier
largas y
individuals live
productivas,
longer and more productive
contribuyendo al
lives,
desarrollo
contributing
de
to the
sus
development
comunidades y
of their
países.
communities and
Y en
countries.
ese contexto,
And in
aquí
that
vamos
situation,
a
here
conversar
we will
sobre
be discussing
varios de estos aspectos
on many of
que
these
van más
aspects
allá
which go
de
beyond
incluso aumentar el gasto público en
even
salud al
increasing public
6%
healthcare
del
expenditure to
Producto Bruto
6% of
Interno.
GDP.
Innovación en mecanismos
Innovation
y en
in
mecanismos que sean
mechanisms and the
efectivos
mechanism which
en
is
la
effective
asignación de recursos,
in the allotment of
información
resources
clara y
with
con
clear
capacidad
information
de
and with a
regular
capacity to
e
regulate
incentivar
and
la
incentivize
provisión de los servicios de
the
salud
provision of
y
healthcare
mejorar
services
las condiciones de acceso a
and
los servicios de
improving
salud a
access
toda la
conditions to healthcare
población.
services
Todo
for the
ello es
whole of the population.
necesario
All of
para
this is
garantizar
necessary
desde el
to
aspecto del
guarantee from the
financiamiento
aspect of
esto que
funding
para nosotros
this,
es
which for us is
una referencia central, que es el
a
acceso
central
universal a la
reference, which
salud y
is
la
universal
cobertura
healthcare access and
universal de la
coverage.
salud.
universal
desde la
healthcare
mirada
coverage.
de
And from the
desafíos y
view
abordaje
of
de la atención primaria de
challenges
la
in
salud
tackling
con una
primary healthcare
perspectiva
attention with a
territorial,
territorial
esto también
perspective,
significa
this also
asegurarse de que los
means
fondos se
ensuring
asignen
for
y
funds
utilicen
to be
adecuadamente
assigned
en
and utilized
regiones
adequately in
tradicionalmente
regions
desatendidas, de
that are
modo que las
traditionally
redes de
unattended,
atención
in
se
such a way
extiendan
that
a los
attention
lugares
networks can
más remotos
extend
del país.
to the more remote areas of
Solo
the
un
country.
último mensaje.
Just one
Sumemos
last message.
nuestros
Let's join
esfuerzos,
our
sumemos
efforts,
nuestras voces
let's join our
y
voices
reflexiones para
and reflections
transformar nuestro
to
sistema de salud.
transform our healthcare
Espero
systems.
que la
I hope
exposición que
that
hoy
a
vamos a
discussion
tener en este
which we'll be having
webinar
today
los
in this webinar
motiven y nos
motivates us
inspiren a
and
continuar con
inspires us to
esta
continue
increíble tarea
with this
de ir
incredible
aportando
task of
pasos para asegurar la
providing
protección de los derechos
or
de la
taking
salud
further
y
steps
el
to ensure the
bienestar de las
protection
personas
of rights,
en nuestra
healthcare,
región de las
and the
Américas. Bueno,
well-being of
muchas
people in
gracias,
our region, the Americas.
Claudia,
Thank you so
muchas
much,
gracias a
Claudia.
todos.
Thank you so much,
Les
everyone.
deseo un buen
And I
seminario
wish you
virtual.
a
Gracias.
good virtual seminar. Thank
Muchísimas
you.
gracias, Ernesto,
Thank you so
por
much,
la
Ernesto,
introducción
for
y
the introduction
por tus palabras
and your words,
inspiradoras respecto a
which are
la
so
importancia
inspiring
que tiene
regarding the
el
importance
financiamiento
that
como
funding
decimos a veces, el
has.
combustible
And as we usually say, this is the
del
fuel
sistema
of
de
the
salud,
system,
¿no?
the
Entonces,
healthcare system.
sin mayor
So
preámbulo, para
without
ir
further
avanzando
ado,
en
and
la
in order
agenda,
to
voy a
begin
hacer
advancing
una
in our
presentación
agenda,
muy
I will hold
rápida
a very fast
del último
presentation
estudio que
on
hemos
the
lanzado y
last
está disponible ya en
research that we
publicación,
have
donde lo
deployed, which
podemos
is now
ver
available
al
as a
final de la
publication
misma,
that we will
y
see at the
mostrarles un
end of
poco
this,
qué fue lo que nos
and to
motivó a
show
generar
you a little what
este
motivated
estudio.
us to get into
Em,
this.
la gestión financiera pública es un tema del que no
Public
hablamos muy comúnmente,
funding management
pero
is
está
something
definida
that we
como el
do not
conjunto de
usually
reglas,
discuss. It is
instituciones
defined
y
as the set of
procesos
rules,
que
institutions, and
rigen la
processes which
asignación,
rule the
uso y
allotment,
reparto
use,
de los
and
fondos
reporting
públicos
of
y
public
tiene un
funding,
rol
which
fundamental
has
en
a
la mayor
fundamental role
priorización para
in
salud, como lo
greater
mencionaba
prioritization for
Ernesto,
healthcare,
dentro
as
de la
mentioned by
propuesta del
Ernesto,
6% del
in
Producto
this
Interno
proposal of
Bruto, de
6%
incrementar la
of
inversión
GDP
en salud
in
proveniente de
for
recursos
increasing
públicos,
the allotment of
principalmente
healthcare
impuestos
coming from public
para
funding and
acercarse a
mainly
ese nivel,
taxes in
que
order
está
to
muy bien
approach this
planteada en
level,
la
and which is
Estrategia de
very well
Salud
proposed
Universal y
in the
ratificada
universal
en la
healthcare
Estrategia para el
proposal
Establecimiento de
and
Sistemas
confirmed in
Resilientes de
the
la
strategy
OPS,
for the
que
establishment
enfatiza la
of
relevancia del
resilient systems
del
in PAHO,
presupuesto público.
which
Este
prioritizes
proceso
the
de la
relevance
gestión
of public
financiera
expenditure. These
pública
processes
gira
and public
precisamente en torno a las
funding
etapas de formulación, aprobación,
uh,
ejecución y
go
evaluación del presupuesto
according
en la que
to
participan
formulation
diferentes
stages and
actores.
also approval, execution, and
Los
evaluation
presupuestos
of budget,
públicos de
where
esta
many
manera
stakeholders
sirven
participate.
como
Public
mecanismo
budgets in
por
this manner serve
excelencia
as a mechanism by
para
excellence
expresar y
to
revisar las
express
políticas
and review
públicas en las que se
public
plasman las
policies
prioridades de los
which
diferentes
set
sectores y por
priorities
parte de
in
los
many
gobiernos y
sectors and by
se
governments.
articula también el modelo de
They also
atención
articulate the
y
model
se
of attention
reasignan los recursos en
and
función a
they
la
reassign
coyuntura, a la
resources based
planificación
on
estratégica y sus
strategic
objetivos,
planning and its
y también
goals,
ante
and
eventos de
also
emergencia
before
sanitaria,
events
como
of
fue el caso
public
de la COVID-19.
healthcare, such as with the
¿Cuál
case
fue
of
la
COVID
motivación
19,
principal
which was the
del
main
estudio?
driver for the
Durante la
study.
pandemia de la
During the
COVID-19
COVID
se
19
observó
pandemic,
un volumen sin precedentes
an
de recursos
unprecedented
públicos
volume
que fue
of public
destinado al
resources
sector
was seen,
salud
which was
para
destined
atender y
to the
mitigar
healthcare
el
section
impacto
to
de la
tend to
misma.
and mitigate the impact
Nos
of the
surgieron,
pandemic.
por tanto, las siguientes
Therefore, the
preguntas,
following
que son las
questions
que tratan
arose,
de
which
responder
are
esto.
those who
¿Cómo
try,
afectó la
which
pandemia
the study
COVID-19
tries
a la
to respond.
formulación
How
y
did the COVID-19
ejecución del
pandemic affect the
presupuesto
formulation and
en salud?
execution of
¿Se dio
healthcare
realmente
budgets?
prioridad al
Was
primer
there
nivel
really
de
a
atención
priority
como
for the first
pilar
level of attention
fundamental de
as a
la
fundamental
estrategia
pillar
de APS
of the
durante el
APS
periodo
strategy
2020-2021?
during the term
¿Hubo algún
2020-2021?
cambio de
Was
prioridad
there any
en
change in
cómo se
priority
asignaron los
in
recursos
how
comparados con el
resources
periodo
were allotted
prepandemia?
comparing to the pre-pandemic
Finalmente, ¿hubo
period? And
innovaciones
finally,
en
was
la
there innovation
canalización de nuevos
in the
recursos
channeling of new
en el marco de
resources
la gestión financiera pública?
under
Y si
public
los hubo,
management
¿cuáles fueron?
funding? And if there were,
La
which
metodología
were
del
they?
estudio
The methodology for the
fue la
study
siguiente.
was as
Se
follows.
realizó una
A gathering and analysis of publicly available information was performed in 8 countries of Latin America and the Caribbean, including Chile, Colombia, Guatemala, Honduras, Panama, Peru, the Dominican Republic, and Uruguay. The period of analysis was 2020 and 2021, the first year where the pandemic hit in 2020, and then in 2021 with the coming about of vaccines, and taking 2019 as the base year for pre-pandemic comparison. Financial information was collected by budgetary stage, trying to compare the initial and final budgets, and the rates of execution were calculated regarding both budgets. The quantification of assignments or allotments at the first level of attention was performed via budgetary programs. This is operative expenditures of the first level attention and preventive healthcare programs. This includes cases where social security is integrated to processes and stages of public management funding, such as the case of Chile and Honduras. Usually, public funding management is only related to the collection of general income. So as for our main results that we would like to highlight in this presentation, on this graph, we attempt to compare the rates of budget execution per sector based on the initial budget. This is to research how the healthcare sector behaved comparing to other sectors. The bars, every color represents a different year, 2019, 2020, and 2021. And what we can see, or what we see in our research, is that in 5 of the 8 countries, execution of the healthcare sector based on the starting budget overcame those in other sectors in the year 2020, so in the year of the shock. Exceptions were in the case of Guatemala, here in a red circle, as well as Honduras and the Dominican Republic. In other words, in the main year of the crisis, the other sectors executed more than the healthcare sector in terms of percentage regarding the initial budget. In the second graph, we attempted to compare the budget execution rates based on starting and final budgets in the term 2019 to 2021. Every bar again represents 1 year and compares the case of every country. For example, in the case of Chile, we have execution of budget related to the initial budget and execution regarding the final budget. And we see that in spite of adjustments to healthcare budgets, in most countries, the execution capacity of the final budget decreased comparing to the year 2019, and that in the year 2021, there's a recovery via acquisition expenditure for vaccines. In this chart, we now specifically present whether there was a prioritization of the first level of attention in the healthcare budget executed during the same period. And we see that indeed, whenever we include expenditure to tend to the COVID-19 pandemic, there was a prioritization of the first level of attention in 5 of the 7 countries assessed. This is Chile, Guatemala, Honduras, Peru, and Uruguay, which suggests that there was an increase of participation of the first level of attention in the healthcare response during the emergency. In other words, what we would have expected. On this chart, we present prioritization of the first level of attention, but now excluding those records that were dedicated to tend to the COVID-19 pandemic within the executed healthcare budget during the same period. And what we can see is that except for Peru, excluding expenditure for COVID-19, the prioritization of the first level of attention decreased comparing to the pre-pandemic levels, which is what we would have not have wanted to see. In some cases, it was more dramatic than in others. For instance, in the case of Europe, of Guatemala, if we compare the year 2021 against 2019, in the case of Uruguay, there's also a decrease, and in the case of Peru, it, it remains relatively stable. As for our main conclusions and recommendations, the study was a first attempt to generate evidence on prioritization in the first level of attention as a fundamental pillar for the primary healthcare attention strategy, attempting to include elements of public funding management. The analysis clearly manifests the importance to strengthen the capacity in the system to be able to absorb resources via better strategic planning, which makes feasible and efficient and equitable use of resources. This means that if the proposal is that we must increase investment, public investment in healthcare, then the system must have also the capacity to be able to take up those greater resources. Another conclusion is that a greater prioritization of the first level of attention happened in a situation of emergency and in a situation of much pressure. However, when we exclude the COVID-19 component and we see how the execution percentages are behaving, this suggests on the need to continue strengthening investment in the first level of attention, but in a sustained manner in the long run, not only as a response to the need to attend to an emergency. And this study or research will be complemented with some others. For example, we have another research which attempts to investigate which were innovations in public funding management, which allowed for this increase in the available resources for the first level of attention. And we also have as a pending task to be able to establish relationships of this between this information with the allotment and the use of resources with non-funding access barriers and the interruption of essential services during that same period. To finish, I leave you with a QR code to the publication, which is available. You can now review it, and we will be expecting your remarks. Thank you so much for your attention. And now I would like to hand the floor in the second part of our seminar to be able to share another important input to our discussion on funding of primary attention in healthcare. For this, we have invited Dr. Hernan Rodriguez. We will now hand the floor to him. Hernan is counselor to healthcare systems in representation of PAHO WHO in Peru. He will be presenting the case in the country case on a research that was made based on prioritization of investment in for primary healthcare. Welcome, Hernan, and go ahead.
Claudia.
Thank you, Claudia. I hope that you can hear me. Good morning, everybody. It's a great pleasure to be here in this webinar. And as was mentioned, I will present a study we did here in Peru about public expenditure on the first level of care. And I would like to thank Dr. Cárdenas for her help in in establishing this study, and all the actors of the health system in Peru, all the subsystems, including the armed forces, and because without their help, it wouldn't have been possible to obtain these results. And I also thank Claudia for their systemic support, system support. This is the first slide. Before showing you the goal and the methodology and the main results, I want to show on this graph that the health system in Peru, as many of the health systems in our region, it's a fragmented system. It's a country with more than 33 million inhabitants, with 3.3 expenditure of the GDP, and with an insurance of about 97% through public health insurance, a part of it through the social security system, which you see here. Here you see the different subsystems. There is the Ministry of Health and the Social Security and the Armed Forces, police. We have the Navy here. We have the penitentiary system. But these institutions belong to other ministries. In the case of health, of the Social Security, to the Ministry of Labor, in the case of the armed forces, and the police forces, and it's part of the Ministry of Domestic Affairs, and we also have a supervision of different entities. Here we see decentralized entities that are participating in the regional and local government, such as the regional directions of health and the unit of management in other countries. These are translated as health secretariats, and there are other sectors that are represented here. So this is a general framework of the system. The main goal and the specific goals, well, I won't read them out because you can see them on the slide, because the sources of the budget were improved not only in the assignment of resources, but also in the execution. These were the objectives of the study, also to describe the first level of care and to develop a methodology for estimating the expenditure of primary health care and the performance of the expenditure. Well, these are the first level of care entities, and we wanted to look at the sources of financing and the payment methods. You see these are in part, or the system is financed by ordinary sources and by resources directly coming from the executive units and by donations and transfers. We wanted to establish a methodology that helped the country to use this same methodology and to carry out this analysis also in the following years. Because it's very important to estimate this expenditure, not only regarding the assignation of resources, but also the type of expenditure, how these resources are used. Here we have the description of the first level of care. I believe that, well, it's also already part of the repository of the of PAHO, and it will probably be published later on. Here you see the distribution of hospitals, specialized institutions, etc. And on the lower part, you will see the number of primary health care well, primary healthcare centers, and they are classified in a category between 1 and 4. That is with, well, the equipment, it describes the equipment and the staff that is present at the different centers. And you see also the distribution of these centers, and great number of them are part of category 1. I will show you some examples of this organization because we're talking about 8 subsystems, and it's impossible because of the time allotted to describe them all. But regarding the first level of care, here you see the health ministry and the regional services and units, and the integrated networks. The country comes from, well, recently in 2018, there is a new law was implemented, and here you see the new division in functional units, and then you have the IPRES that are entities, service providing entities. And IAFA-CIS, well, IAFA is the unit in charge of the management of healthcare, of the healthcare system. Then we have the essential insurance plan for health, and also the high level of high cost level of diseases, or well, here we have the assistential networks. We have the social security that doesn't have comprehensive networks, but it is making progress in that sense. It has an administrative team, and in the lower part you can see that there are insurances of 2 types. The main registered persons and their families or dependents. Then we have here the Peruvian Army. They also have administrative and executive units. We talked to the Army, to the Navy, and the Air Force, and there is an administrative unit for all of them, and there are 144 centers of first level of care. And as you know, the administrative unit, there's also an administrative unit and insured people of two types. Here you see the financing of the different units. We have the rectorship. This is in the hands of the Ministry of Health, and there is also a National Superintendency of Health that takes care of the regulations and the supervision. Then we see here the sources of financing, the general taxes, the expenditure by household, and the donors. The donors, well, depend on the Ministry of Justice. In the case of Metropolitan Lima, for example, there are comprehensive networks called DIs, and in the provinces we have the regional and local networks. And about 68% of the population is affiliated to the system. And here you see how the assignment of resources has taken place. The historical budget is the variable historical budget is in blue, the fixed budget in black, and the occasional resources from other sources are also included in the blue part, and the payment per capita is in red. In 2021, this mechanism of payment was changed, and the payments for the insured people are adjusted according to their income. So the average is about as an example, in Callao, it's about $25, and in Huancavelica, 40.4. It's about 64% in general, 25% to 44%. And here we have the different subsystems and the financing sources. And apart from carrying out an analysis in all regions, we also included 5 regions with an important criteria, because these 5 regions receive the greatest budget assignments. And here, the pensions systems is not included. And you can also collect information. This is why I thank all the institutions. Here you see the Ministry of the Economy and Finance and all the others institutions that were participating. And I also thank all the participants for their help in organizing and providing the existing data. In the case of resources and expenditure, here you have the division, subdivision, and the different sources so that you can have a better view of the general situation. Looking at the percentage of the budget, national budget assigned to the first level of care, it's here in orange, and it was compared also with the second and third level. And here you see that the budget assigned has been increased for levels 2 and 3, not only for level 1. So this is very important here in Peru for the first level of care. And if we look at the 3 types of expenditures, the execution of the budget, you should remember that we also saw donations and transfers and resources, direct resources and ordinary resources. In the case of ordinary resources, the percentage kept more or less stable during 5 years. And in the case of donations and transfers, the country tried to maintain the level of execution of the budget, but there was a period in 2020 where there was a decrease in resources. If we look at this in millions of soles, if you want to transfer this into dollars, $1 is 3.7 soles. This is the evolution along the 5 years of work. And here we see how much was assigned and how much was executed. In all these years, the execution of the budget was more than 90%. And as I said at the beginning, including included in the goals. We have also um, the staff, well, the type of facilities, etc. And here we see in this table, well, we wanted to convert this into soles here on the left, and also the variability. You see the variability between the regions. It's also in current dollars. And here we have a difference also in the per capita budget. Now, we also reviewed the purchase of goods and service, and the hiring of services, purchase of medication and resources and input. And this is the in yellow you see the initial budget that was modified, and in blue the historical one. And here you see that there is always an increase. For Esalud, well, we weren't able to gather all the information about the assignment of resources, but we were able to get the figures for the executed budget, and here we see that the larger assignment of resources is in the second and third level of care. And I here want to say that the first level of care has health care centers at the three levels. And you can see that this is a health system that is segmented into 8 subsystems that have a different user population and different schemes for organization and financing. And the 52% of first level care establishments are they are of category 1-1, and that is, they do not have a medical staff. And there are limitations also and some gaps in order to be able to provide medication and other supplies, and also limitation of human resources. But here the important message is that apart from assigning the assignation of resources and the execution of resources, and this is something we want to study further on also with the results in the health level compared with the level of development also, and also the management of high blood pressure and diabetes and other chronic diseases. And talking about the Ministry of Health and the regional governments, we see that there is an increase. We have arrived at 44 to 53%. And these are all the sources of financing except of expenditure, investment, and pensions. And we have 349 soles, that is $94 as the per capita expenditure. And in the case of Esalud, we see also the difference in comparison with the first level of care. And as you see it here, Esalud represents the 8% of the whole budget for the first level. It includes all the human resources, goods and services, and the average level of budget execution for these 5 years of work has been between 94%, 94.03 and 94.29%. So it has been stable. Well, this presentation is just a glimpse of the whole study that was carried out, but I hope that it is you find it useful for your work. Thank you, Hernan, for this excellent presentation. This is a study that we followed, that we accompanied since the beginning. And it's interesting to see the differences between the prioritization of the first level of care through APS in Peru. This is quite remarkable. In the next section, we call on the panel in order to talk about the main issue, which is the financing of primary health care, focused on the first level of care. And so I will hand over the floor to Wilson Benia, who is representative of PAHO in Uruguay. Welcome, Wilson. I think his microphone is off. Yes, Wilson, your mic is off.
Buenos días
Good
a
morning.
todos y todas.
Good morning, everybody. I want to tell you that in December last year in Montevideo, with PAHO and the World Bank, we started this alliance for improving the first level of care. And this, in all the countries of Latin America, through more investment, innovation, and management. And so we are going to talk about the challenges that Claudia mentioned and Hernan showed us for Peru, and compare them with the opportunities of the joint work of all three partners in this. For this session, then, we want to introduce Christian Herrera from World Bank and Sebastian Bauhof from the Inter-American Development Bank. And Sebastian is an economist, is a principal economist of the IDB. He has 2 decades of experience in investment in sanitary and health. He graduated from the London School of Economics and from the Harvard Business School, and also other diplomas. He is in charge of the Latin American and Caribbean region at the IDB. He has been in charge of very important offices, also as Vice Minister of the Economy in Chile. He is a physician, graduated from the Catholic University in Chile, and he has diplomas in health management from the University of London and University of Chile for public economics and political science. Thank you both, Chris, and for accepting our invitation. And starting with Sebastian. Sebastian, I want to ask you a question, and we will have 5 minutes for your answers. The same thing with Christian Herrera. So some months ago, some thoughts were published about the improvements in expenditure and the resilience of healthcare systems by increasing investment. And how do you think we can improve the efficiency of our healthcare systems in the region, and which do you believe are the main pathways for this intent?
Thank you so much, Wilson, and thank you, Claudia and colleagues, for the important report and also for the case study of Peru. Very much appreciated. And thanks for having me here. Let me start by saying something that Ernesto mentioned in his introductory remarks, which is that health spending in our region is low and needs to increase. But as Claudia was showing earlier, we also need to work on improving budget execution and improving the efficiency of our current health spending. So I know the efficiency part is sometimes not as exciting, but let me see if I can get you a little bit excited about this. We at the IDB have done a series of work on improving health systems performance by improving spending efficiency in health. And I think this is important for at least two reasons. One is to get more value for our money. For every dollar that we don't spend efficiently, we lose the opportunity to invest that dollar in the health system. So that's one reason. And the second is that improving efficiency can also help us as the health sector to advocate for more spending on health. We need to show value for money in our sector. And so efficiency is an important part of that. So the way that I look at efficiency is as an opportunity. It's really an opportunity to do better with the resources we have and use those resources that are better to improve lives. We have some recent estimates that you mentioned, Wilson, that suggest that we can save about 3.5 years of life expectancy per capita, at birth with the same per capita spending. And just to put that into context, 3.5 years of life expectancy at birth is about the progress that the region has made overall between 2000 and 2015. So it's 15 years worth of progress that we could potentially gain, or at least some of it gain, or realize if we spend our money more efficiently. So that's what I mean by a big opportunity, and that's the reason why I think this is actually an exciting area to work on, an exciting area of policy. Now, you asked about the pathways to improve efficiency. We think about sort of three pathways. One is buying the right things. The second is to get better deals on what you buy. And then the third one is reduce wasteful spending. So let me go quickly over all of these with a couple of examples, if I may. So on the first part, buying the right things, this is really about being clear about what your goals and priorities are for the health system, and then allocating the resources that you have or that we have to meet those goals in the most cost-effective way. At the IDB, we've done a lot of work on priority setting and supported a lot of country efforts, partly through our criteria network, and proposed things like using health technology assessments for determining what technologies and services provide the most value, and then defining explicit benefit packages to prioritize cost-effective interventions. And there's many examples of this already in the region: Uruguay, Chile, Honduras, just to name a few of the friends that are here as well. I think this part of buying the right things and being clear of what you want is really important, because if you don't know what you want to spend your money on, what you want to prioritize, then that money is gone and you can't spend it on the stuff that really matters to you. So I think this is really important. And this pathway also suggests very clearly that we should be allocating more towards primary healthcare and improving primary healthcare. So this is a big part of the efficiency agenda, investments in primary healthcare. So that's the first part, buying the right things and being clear about your goals. The second is getting better deals. So that's basically saying buying the same inputs and services at lower prices or producing them at lower cost. Claudia already alluded to a few of those policies that are useful here: improve public financial management, improve procurement practices, pooled procurement, where we have also examples at the national level, like Chile and Colombia, and at the regional level, including PAHO, for example, the strategic fund. It also includes paying lower prices for similar goods and services. And there, I think one really important agenda item is to increase the penetration and the use of generic drugs in the region. Across Latin America, maybe a third of the pharmaceutical market is unbranded generics. In Europe, it's closer to 50%. And in some countries like the UK and Canada and Germany, my home country, it's more than 70%. So there's clearly a lot of room for efficiency gains here. The third item is reducing wasteful spending, and basically reducing spending on services, drugs, and devices that are harmful, that are wasteful, or just ineffective and provide little value. Now, we can spend a lot of time talking about this. This goes from anything from clinical to operational and administrative waste. But I would like to highlight one area that is maybe not as obvious, which is the low quality of care. We know that quality of care is a problem for our region, and low quality of care has many problems, but one thing is also it is inefficient. We will get better results for our spending if we have higher quality of care. So I think tackling quality of care is really an important area for improving efficiency. So as I said, there's many examples in the region for each of these three pathways: buying the right things, getting better deals, and reducing wasteful spending. So I think really this is an agenda, the efficiency improvement agenda that is feasible. A lot of it goes to primary healthcare. So I think it's a good moment to sort of use that agenda also to make efficiency improvement. And just to summarize, I think there's a huge scope for improving spending efficiency in all countries and across the region. I think this is feasible. We've seen lots of examples already in the region. Many of the colleagues here on the webinar could speak to that. And I think it's exciting because it's really a big opportunity for us to improve health outcomes in the region. So with that, let me hand back over to you, Wilson. Thank you so much.
Muchas gracias, Sebastián. Cristian,
Thank you so
ustedes han
much, Sebastian
trabajado
and Christian. You
extensamente
have worked
sobre la
extensively on
resiliencia de los sistemas.
resiliency of healthcare
¿Cómo
systems.
crees que pueden los sistemas de
How
salud
do you think that
fortalecer su
healthcare systems can
resiliencia y
strengthen
garantizar
their
un
resiliency and
financiamiento sostenible y
guarantee
adecuado para el primer
sustainable
nivel
and
de
adequate
atención,
funding for the first level of attention,
especialmente en
especially
contextos como
in
los que vivimos
situations
hace 2
as
años
what we
en el marco
experienced
de
a
la
couple of years
pandemia del
ago
COVID-19
under the
de
COVID-19
crisis
pandemic
sanitaria y
of a
crisis
healthcare
económica
crisis
a
and
la vez.
economic crisis at the same
Adelante,
time.
Cristian.
Go ahead, Christian.
Muchas gracias, Wilson, y bueno,
Thank you
gracias
so much,
a los
Wilson, and
colegas de
thanks
OPS
to our
por
colleagues
organizar
from
este súper relevante
PAHO for having
e
organized
interesante
this
seminario y
highly
por
relevant and
invitarnos
interesting
también
seminar,
a
and for
participar.
having
Saludos también a
invited us all
Sebastián del
to
BID y bueno, a
participate. And
todos y todas las
greetings
colegas
to Sebastian from
de
IBD
la
and all
región y
our
también creo que hay
colleagues
personas
in the region. I
fuera de
also
la
see
región que
people
están
who are from without the
conectados.
region
Gracias por
who are
su tiempo.
connected. So thank you for
Bueno,
your time.
resiliencia,
Well,
gran tema. Hoy día hay
resiliency
ciertas
is
cosas que son
a greater
transversales también,
matter,
que
and
por
there
supuesto
are
aplican
several
a
cross-cutting
resiliencia,
issues
pero
that,
que a la
of
vez van a
course,
fortalecer
apply to
el
resiliency, but
sistema
that
en
they will,
general.
of
Entonces,
course,
esa
strengthen the
sinergia yo
system
creo
in
que es
general.
súper
So this
positiva.
synergy, I
Algunos
believe, is
puntos. Lo
super
primero,
positive. So
sí,
several
se
points. The first
relaciona
thing to
mucho
say, which is pretty much related
con lo que ya se
to
estaba
what
comentando, ¿no?
has already
Tiene que
been
ver
said,
con saber cuánto
and
se
this
gasta,
is
cuánto
knowing
efectivamente
how
se
much
gasta
is spent effectively
específicamente en
and
atención primaria,
specifically in primary
y luego
healthcare
poder entrar a más
attention,
detalle, ¿no?
and
El
later to
desafío es
get
grande
into
porque
more
sabemos
detail.
que
And the challenge
existe una
is large,
metodología,
as we
las
know.
cuotas nacionales de
There's a
salud que ayudan
methodology of
a
national
estimar
healthcare
los
accounts which
gastos de los
help
países de la región.
to
Van
estimate
avanzando en eso, la
expenditure of the
OPS
countries in
por
the region, and
supuesto ha hecho
there's
mucho
progress on that.
trabajo
And PAHO, of course, has
en esa línea con
done many
asistencia
strides on that
a los
line with
países, pero
assistance
aún
to
falta, ¿no?
countries,
Y
but still there is
específicamente si
more
nos
lacking.
movemos a
And
atención
specifically, if we
primaria,
move to primary
falta
attention,
en homogeneizar
there's a lack of homogenization
trabajo
or
es cómo medir qué
standardization of
entendemos
efforts, how to measure
para
and what we
integrar
understand
en esa medición
in order to
del gasto en
include
atención
in this
primaria.
measurement
Entonces, el
of
estudio
public
que
healthcare
Claudia nos
expenditure, and that is
mostró
the study that
es
Claudia
súper
showed us.
relevante, interesante,
It
sirve
is
para mirar
very
la
relevant and
evolución de cada
interesting, and it
país,
serves to
pero yo
look
creo
at
que
the evolution in every
estamos en
country.
ese
But I would say
periodo
that we still have
de cómo
this
hacerlo y llevarlo un
challenge
poquito más
in
homogéneo para comparar
making it
también
more
entre los países. Y
homogeneous
esto es algo
in
que
order
no
to
es
be able to
solo de
compare
esta
between
región,
countries
es un
as well. And this is not
desafío
only
de hoy día casi
something
global
in our region, but I would
poder
say this
avanzar
is
hacia allá.
almost a global
Y
challenge.
luego también ir
And
entendiendo
also
en
understanding
qué se está gastando. Veía algunas
in what
preguntas en el chat
uh, there
también
is
de, por ejemplo,
expenditure.
cuánto
There were
se
some
gasta en
questions via the
promoción, en
chat on how much is
prevención, ¿no?
spent
En
on
ciertas
promotion
actividades
and
que
prevention, certain activities
son muy
which
relevantes, ¿no?
are very
Y una de las
relevant.
áreas que uno podría
And
pensar
another area that
es
one might think
efectivamente en
about is
actividades relacionadas a fortalecer la
activities
resiliencia
related
de
to
sistemas.
strengthening
Entonces,
resiliency of
y
systems.
ahí lo primero a preguntarse es qué hace
And
la
so the first
atención
thing there
primaria
to ask is,
para
what does primary
contribuir a la
health attention
resiliencia del
do to
sistema de salud
contribute
en
to
su conjunto.
resiliency of the healthcare
Esa es una pregunta
system as a
clave.
whole? That is a
¿Cuáles
key
son los
question.
nuevos roles, las
What
funciones
are
que
the new
tiene que tener la
roles
atención
and
primaria
duties that
para
primary
ser
attention must
resiliente
have
en sí misma,
in order
pero
to be resilient
pensando en el
itself,
sistema
but
en su conjunto?
thinking about the
Esa
system as a
pregunta
whole?
aún estamos
That question,
trabajando
we
y de
are
hecho lo estamos
still
trabajando en
working on it.
conjunto
In
con
fact, we are working on it
OPS y con
jointly
el BID también en la
along with
Comisión
PAHO and IBD,
Lancet de
also
Atención
in the
Primaria y
Lancet
Resiliencia.
Commission
Entonces
for
esperamos
Primary
entregar
Attention
algunas
Resiliency.
luces
So
con
we
respecto a
hope
eso
to shed
y
some
luego,
light
por
regarding
supuesto,
that. And of
podemos
course, later
intentar
we
hacer la
can
conexión a
attempt
cuánto
to establish a
efectivamente se
connection
está destinando
into what
de
indeed
recursos.
is
Eso me
being
lleva al
allotted
segundo
in,
punto.
in resources, and which leads me to the second point, which is having funding for resiliency. This is something that is key. The emergence of public health care in the broad sense of the term, not only epidemics or pandemics or epidemiological emergencies, but other possible shocks, for example, climate change, migrations, economic shocks, and so on. There are many threats in emergencies, and so they will continue happening, and all countries are experiencing it. So the issue is how to generate funding mechanisms for this, which indeed, in a planned and structured manner, can fund the prevention of these emergencies, as well as preparation and response, and also learning, which comes later. So the full cycle of resiliency that actually is not as structured nor as intentional in terms of funding this in a clear manner. An example is having contingency funds so that when an emergency occurs, having funding that can be released. So as development banks, we also have instruments to support countries which deliver resources only when emergencies occur. So a full operation for funding is prepared, which delivers this resources only if and when an emergency happens. This is an example of a tool that we have to support countries with. And also this kind of funding can deliver, so funding for resiliency can deliver incentives to bring about transformation and primary attention in the territories. And a clear example is that we need to understand clearly at the level of the territories which are emergency risks. Those emergencies in the north, center, and south in the many parts of the many countries are very variable. So it cannot be a single kind of preparation for the whole country. This must go down to the level of territories, which also requires funding in order to be able to have this understanding in terms of the risks existing with emergencies at the level of territories, and later to plan based on those risks and to bring about intersectorial capacities as well. And then, of course, later at the level of territories, in some cases, municipalities, in other cases, other entities that must also be there. And this has a correlation in terms of funding and financial management and so on. So there are some key points to comment on during the discussion. Thank you. And thanks to you, Christian. Finally, we are short with time. So to finish this session, I would ask you both
les voy a pedir un esfuerzo de síntesis en
a question,
respuesta
and I
a la
will
optimización
ask
del tiempo.
that you
¿Qué
synthesize, that
sinergias les
you
parece que podemos generar
abbreviate your
con
answer.
el trabajo de estas
What
tres
synergy do
instituciones,
you think we can
BPS,
generate
BID y
with
Banco
under the
Mundial,
efforts of the three
en el
institutions,
marco de la
PAHO,
Alianza
IBD, and the
por
World Bank,
BPS
under the framework of the
para
Alliance for the
fortalecer
PAHO, to
la
strengthen
resiliencia de los sistemas de salud?
resiliency in
¿Qué
healthcare
sinergias se pueden
systems?
hacer en
What
este marco
synergies
de
can be
alianza
had
por la APS
under
por parte
this
de las instituciones? Adelante, Sebastián.
PHA alliance with the institutions? Go ahead, Sebastian.
Thank you so much, and thanks, Christian, also for those observations. I think we'll probably agree that for us the most important part is to better support our countries in a coordinated way, and I think the Alliance provides a great way to streamline support that these three institutions can provide to countries to develop their own long-term investment plans and then to support putting that into action. I think it can also help to us to sort of develop our common tools and deploy those common tools for the benefits of the countries. I think this is really an excellent platform to collaborate and coordinate for the benefit of the region and the countries. Christian.
Gracias, Sebastián. Gracias, Wilson.
Thank you, Sebastian. Thank you, Wilson. And just quickly to elaborate on what Sebastian is saying, that undoubtedly that's the spirit that the Alliance has. Two examples, and I will repeat on one. The first, I believe, is key to be able to understand how much is spent in primary attention, which gives us key tools for an exchange with ministries of treasury. This, I believe, is very, very important, being able to have clear numbers for the discussion and to be able to expand ideally the investment in primary attention, and then to get into more details in order to begin understanding this. This is something that we, between the three institutions, can, in aligning ourselves, we can facilitate that effort and to better support the countries. Second, we are already working on this, somewhat related to, in terms of efficiency that Sebastian had mentioned, payment mechanisms. How we're going to streamline payment mechanisms for primary attention, capitation, risk adjustments, capitation, thinking about networks as well, not only in primary attention, to look into if somehow in terms of incentivizing results for patients especially, we, there can also be something on that end. And for all of this, we need, of course, better information systems to measure and to measure better. This, I believe, is something that we can also make an intention in a better way among the three institutions and prioritize to better collaborate. And the third and last point is that there are countries that are advancing on structural reforms, some which have already taken efforts, such as Mexico, Colombia, Chile. These are countries that are pushing on major reforms, which include primary attention as a major issue. And something that joins us is not reduction of fragmentation. I was saying that for Peru, this is also a common denominator: fragmented funding, fragmented systems. I believe this is an agenda where also we should align to conceive this more long-term reforms, which is something that we need to also keep in mind, because in this way, this will bring benefit to all people, patient systems, budget, and so on. So I believe that those are some lines where we can more concretely advance jointly on. Thank you so much to both of you for your remarks and for participating in this discussion. We would now like to add voices from countries, which is why we have prepared a discussion session to hear about experiences and challenges in prioritization of primary healthcare attention in, in the investment in many countries. So I will now hand the floor to our colleague, Julio Mieses, who's an international consultant on economy and funding from PAHO WHO, in order to facilitate this conversation. Go ahead, Julio. Thank you so much, Wilson. So for this part, we would like to know comments from our guests from Paraguay and Chile. We now have Dr. Jimena Barros from the funding work group APS Occidental Chile, Mr. Osvaldo Brites, Director of Budget from the Ministry of Health Paraguay, and Dr. Susana Cabrera, who works on norms for first level attention, Ministry of Healthcare Paraguay. And last, Dr. Brenda Morales from the Planning and Assessment Unit for Management of the Healthcare System of Honduras. We will begin with Dr. Barros. It is of our knowledge that Chile is in the midst of a process to modernize the primary healthcare strategy to better cover the public. Can you explain to us which have been the main innovations in the funding model for universal primary healthcare attention? What have been the preliminary outcomes from the pilot? I will now hand the floor to Dr. Barros. Thank you so much. We, from the reform that is being proposed by the current government, we took the decision to work directly toward universal access and coverage. So we are working actually on improving provision with a call for individuals who have private insurance can join the advantages that primary healthcare has in our country. And from there, from the results from this pilot, to be able to sustain an idea for change toward the funding model, which now has more than 30 years. And there are 5 lines that we would like to see through this reflection that is held with the members of our ministry regarding funding mechanisms for primary attention and funding itself. And this is regarding capitation, for instance, waiting times and how it behaves in terms of an incentive and to people who are more ill, which can serve as a system for exponential which can affect finally the hospital system, possibilities for coverage, and to have large population groups in each of the establishments, and the value that is also allotted per capita on whether it really works to cover the needs of people, and also to determine whether per capita is functional or whether it needs to be supported with a different blend of funding systems. Also to review the form of indexers. We have an adjustment system for per capita via other indicators, which makes it so that this increases to the measure that it reflects difficulties in the performance of primary attention in geographically difficult or risky locations, and so on. And that should also be changed because it only represents a shift in 20% of everything that municipalities receive on this, and also to have alignment between incentives, payment for performance, and to determine whether this operates in a way that it can mobilize teams to keep populations healthier, and also the role of reinforcement programs, which is another road for funding that is very similar to pays for service, which has a different logic also in devaluation. For this time, what I can say is that our pilot has thrown good results in terms of coverage and access. It has increased funding that municipalities handle regarding primary attention, which translates into an increase in hiring and provision and attention schedules, and also an increase in people enrolled in our establishments, the majority of them from public healthcare insurance or private insurance. Also, we have had very good acceptance from cities, communes, municipalities that are actually rural, who had never had the presence of this government in their territories. Very well, thank you so much, Dr. Barros. We will now proceed with Osvaldo Brites and Dr. Susana Cabrera from Paraguay. In Paraguay, primary attention in comprehensive networks as part of national policy for healthcare 2015-2020. Can you tell us how the country has prioritized primary attention in healthcare after the COVID-19 experience? Good morning, everyone. Can you hear us properly? We are sharing, as was said by Dr. Cabrera here. Well, to resume, Paraguay begins on a path to primary attention approximately in September of 2008, with a resolution by which primary healthcare attention is approved with the implementation of healthcare units based on family in the national territory. Paraguay has a strong and firm conviction and commitment to accelerate this progress toward access and universal coverage with a view toward 2030 through a strong investment that is well differentiated for primary healthcare attention. In the last years, we have achieved executing satisfactorily, we could say, policies and programs that aim to provide medical attention to the whole of the population, and so that all Paraguayans can benefit from it, which have been strongly reinforced by 2023 by new authorities after presidential elections in the country. The national healthcare policy, which entails 2015-2030, aims at guaranteeing full rights to health, as I had said, based on primordial goals such as advancing toward universal healthcare access and to achieve universal healthcare coverage with a greater possible level in ensuring equity in healthcare, and for this to aim toward social human development, but especially sustainable. As I had well stated, in the last 16 years, from 2008-2009 approximately, the budget of primary healthcare attention and the component of the Ministry of Health has experienced an average growth of 30%,
significa que hubo un
This
aumento de
means that there was
33
an
millones de
increase
dólares
of $33
aproximadamente
million,
de inversión
approximately
en
in
lo que a
investment,
la APS y la implementación de las
apart from
unidades de salud de la
primary attention
familia,
and the
corresponde.
implementation of family units.
¿Me escuchan? Creo que se frizó.
No se está escuchando lo que está hablando la persona.
Por decir,
Oh, can we still hear?
en promedio 35 millones de dólares.
There are apologies to our listeners. There are problems with the audio. We lost our speaker's audio feed, it seems. It's cutting out.
Buenas.
Eh,
Disculpe,
¿Se escucha?
creo que tuvimos un pequeño
I believe
inconveniente
we
con,
have a
con el
small
internet. ¿Hasta dónde nos
problem
podíamos
with our
quedar?
internet connection.
Los
What was the
33
last
millones de
thing that you
dólares.
heard? The $33 million?
Ah, ya, ok. Ese es la participación promedio en dólares
Yes, that's the
que
average
hace a
participation in
un
dollars
30% de crecimiento al
that makes
cabo
for
de todo
30%
el
growth.
16.
Sorry,
Es
the audio is
bueno
breaking up
también
again.
puntualizar aquí que
It's
si
also
bien
good to
estos
note here
recursos
that
provienen de
though
los recursos
these
ordinarios,
resources
vale
come
decir, de
from
la
ordinary
percepción que
resources,
hace
so
el
the
gobierno central de los
perception that the central
impuestos,
government
tasas y contribuciones,
performs
también
from
tenemos apoyo internacional
contributions and taxes, we also
a
have
través de
international support
algunos proyectos como el proyecto del
via some
Pacto
projects
Mundial
such
de
as the World
Desarrollo
Bank
que
project, for
tiene
example,
dentro de
which
sus
has
parámetros el
within its parameters the
fortalecimiento de la
strengthening
habilitación
of
de más
the
unidades de salud
enabling
de la
of more
familia.
family unit
Y
health,
en los últimos
family
5
health
años
units. And in the last
estuvimos
5 years,
nosotros
we were
teniendo una colaboración de
we had a
aproximadamente
collaboration of around,
$1.600.000 en la implementación de
apologies, the
unidades
audio is
nuevas de
breaking up
salud de la
again, the
familia, ¿verdad?
implementation of new medical
Si
family units.
bien, como
Though,
decía
as was said
acertadamente, el
correctly, by
tiempo prepandémico y
in pre-pandemic and
pospandémico
post-pandemic times,
significó un pequeño,
this
una pequeña
entailed a
desestabilización en la
small
inversión.
destabilization in
Eso no
investment,
significó que la
which did
atención
not
primaria en la
mean
salud
that
haya
primary
moderado
healthcare attention
en su
had
asignación y en su ejecución
been cut
presupuestaria.
back in allotment
Tenemos, por
and
ejemplo,
budgetary execution.
entre el
We have, for
periodo
example,
del
between the
2019 al 2021
period of
aproximadamente
2019 to
de 70
2021,
millones de dólares que
an
fueron
average of
asignados
$70
a la
million
APS
that
con
were
una
allotted
ejecución
to
promedio del
PHA with an average
81%.
execution of
Ciertamente
81%.
estamos bajos del 90,
Certainly, we
como
are
estaba presentando
below
Chile y Uruguay,
90, as
pero
was presented by
dentro
Chile and
de
Uruguay.
todo
But
el andamiaje de
after all,
priorizaciones que tuvo el tema
the
pandémico,
prioritization
estamos
scaffolding
en ese
prior to the
porcentaje de
pandemic, we are in
ejecución
that
en los últimos
percentage of
5 años.
execution in
Tenía
the
un promedio
last 5
general
years.
del
We have
86%.
a
Vale
general
decir,
average of 86%.
ciertamente tenemos
So it's worth saying
la
we
perspectiva de
certainly
que
have
aún nos falta
the
un camino por
perspective that we
andar,
are still
pero creo que
missing some
estamos
way to go, but
en
I
la
believe we
senda
are
correcta y
on the
estamos
right path, and
recibiendo todo
we
tipo
are receiving all
de
kinds
esfuerzos
of
y de ayudas para
efforts
que la
and
APS
aid
a través de la unidad
so
de
that
salud de la familia
PHA via the
sea
family
la
healthcare
prioridad
unit
del gobierno nacional
becomes a
y creo que se
priority
está
for the
demostrando
central
por la
government, for the national
asignación y el
government. And I believe this is
crecimiento que
being
ha tenido en
demonstrated by
estos
the
últimos
assignment and the
años.
growth it has suffered in the last years.
Muchas gracias, licenciado Brites y doctora Cabrera.
Thank you so much.
Finalizamos con la doctora Brenda
We will
Morales
now
de
finish
Honduras.
with Dr.
Es
Brenda
nuestro
Morales
conocimiento
from
que Honduras se
Honduras.
encuentra en la
It is of our knowledge
elaboración de
that
su plan de
Honduras is currently
refundación del
drafting
sistema de salud
uh,
2024-2030
reformulation
y
healthcare
que
plan
cuenta
for
con una estrategia para
2024-2030, in which has a
consolidar
strategy
ambos
for comprehensive
planes
networks,
basados en la
both
APS.
plans based
¿Qué
on PHA.
perspectiva tiene el
What
gobierno de su
perspective
país
does
para el
the
financiamiento sostenible de la
government in your country
actualización de la
has
APS y el
to
funcionamiento de las
sustainably
redes
fund
integrales?
PHA and integrated networks? Good morning. Thank you so much for inviting us to this forum. Based on your question on which perspectives does our government have for sustained funding of PHA and the workings of integrated healthcare networks, currently the country has two strategic instruments, which are the National Plan for Refunding of the Healthcare System 2024-2030, and also it has a strategy for strengthening Apologies, we're having problems with the connection. Anyway, we have a strategy for institutional strengthening of integrated healthcare networks based on primary healthcare attention. These two instruments will serve for us to better aim our strategy for strengthening primary healthcare attention in integrated healthcare networks. Actually, we currently, the perspective based on these two instruments,
Se ha
apologies, it
cortado la
seems our speaker
conexión
has been
con la
dropped from the
palabra.
line. Dr.
Otro,
Morales says connection is cut out.
mm,
Julio, creo que podemos pasar a la siguiente pregunta para la doctora Barros.
Julio, I believe we can move on to the next
Sí.
question for
Bueno,
Dr. Barros.
como la doctora Morales no se ha podido reincorporar,
Given that Dr. Morales cannot rejoin,
de cierre, si pudieran
our
responder
next
en 2
closing question, if
minutos.
you could answer in 2
¿Qué
minutes,
perspectivas y retos
what
visualizan en los
perspectives
próximos
can you
años con
envision
relación
in
a
the
las
next
iniciativas y
years on
reformas
new
al
initiatives and
financiamiento de la
reforms
APS en sus
to
países?
PHA funding in your countries? Thank you. First, the continuity of our universal primary healthcare attention in spite of political issues, it would be good to have funding to back that continuity and also to reinforce the way of funding what I mentioned before, which are indexes and reinforcement programs, payment for performance, and to analyze whether capitation is the only way to fund primary attention, as happens here in Chile, as 80% or 75 to 80% of municipal income to provide primary attention goes by way of capitation. And also if a fee for a service could contribute to making healthcare priorities more notable and to have incentives for preventive services. Also to prioritize funding, considering that in the future we will have a greater burden of morbid and morbidity, and also requirements for long-term care. So hence the increase of investment with mechanisms for payments that are specific to incentivize these matters. Primary prevention, secondary and tertiary would also make much sense for savings that the country can have as a whole. Also, the role of municipalities with funding of primary care so that they have incentives for building strategies in territorial health with a view to social determinants of health, and finally to harmonize incentives from integrated networks and to assess the mechanisms which are incentives so that integrated networks can operate based on a view focused on individuals. Thank you.
Julio, estás en mudo.
Perdón, si
Julio,
puede
you're
continuar
muted.
ahora el señor Osvaldo Brites.
Sorry if Mr. Osvaldo Brites could continue.
No la escuchamos.
We cannot hear you.
Licenciado Brites.
No sé si me escuchan.
Sí, ya la
Can
escuchamos.
you hear me?
Sí, bueno,
Yes.
nosotros como Ministerio de Salud actualmente
We,
estamos
as the
abocados en lo
Ministry of
que
Health,
son
we're
las
currently
reconversiones
involved
de
in
puestos de salud.
reconversion of
Estamos
healthcare
haciendo un
posts. We
análisis
are
según lo que tenemos en las
running an
redes
analysis according to what we have in
integrales del
comprehensive
servicio de salud para
healthcare
extender
service networks
nuestro horario de
to
atención ya lo
extend
que
our
tenemos en las
schedule
unidades de salud
of
a la
attention that
familia
we
para
have in
garantizar
family
lo que es
healthcare
la
units in order to
cobertura
guarantee
y sobre
coverage,
todo el
but
acceso a salud,
especially
que es un
access
derecho, ¿verdad?, de
to
todos los
healthcare, which is the
paraguayos.
right of
También
all
estamos
Paraguayans.
trabajando en lo que
We're
es la
also working
reincorporación de recursos
on
humanos, ya
reincorporating
que los
human
equipos de salud
resources,
de la
given that
familia
healthcare
en Paraguay
teams, sorry, the audio is breaking up.
una
I cannot
licenciada en
understand what
obstetricia,
the
una
speaker is
licenciada en
saying.
enfermería
Apologies.
y también los técnicos en
But
enfermería y los
also
agentes
and nurse infirmary technicians and community workers. Another activity that we are involved in currently is also training of human resources so that they can also operate based on compliance to healthcare goals, and they demand wages regarding the compliance to those goals.
Sí, para redondear un poquito y
Well, to
abusando un poco del tiempo del señor moderador, ¿verdad? Queríamos precisar con respecto a qué es, cuáles son nuestros horizontes más
We
cercanos.
wanted to tell you about our
Precisar
nearest
que tenemos
horizons. We wanted
937
to
unidades actualmente de salud de la
well,
familia
say
con una
that we
cobertura
have
poblacional de 2.800.000
average
personas y tenemos
coverage
en vista
of one
inaugurar
coverage of
536 unidades de
600,000
salud
people,
familiar
and we
nuevas,
will
con lo que
inaugurate
recibiríamos a
35
aproximadamente
new,
1.400
incorporate
unidades de
35 new
salud
units
a nivel
for family
nacional que
care
están
at
distribuidas
national level
dentro
that
de
are distributed
249
within
distritos a lo largo del
249
territorio nacional.
districts in the
Tenemos que
whole
recordar que
territory. We
estamos
have
divididos
to
en 18
remember
unidades
that
sanitarias
we are
y esas unidades
divided into
de la familia
18
abarcan aproximadamente el
healthcare regions,
98% de
and
esos
this
distritos,
means
¿verdad?
that we are present in about
Como
98% of
redondeo a
this
lo que estábamos
district.
mencionando y la
And as I
doctora
was
bien lo estaba
saying,
diciendo, nuestra
and
inversión constante en atención
well,
primaria de
our
salud
constant
nos hace
investment
mirar
in
con más
health
optimismo al futuro, ya que ese
makes us
crecimiento
look
del
at
30%
the
lo debemos
horizon
sostener
in
con
an
el compromiso
optimistic
del
way,
gobierno
because
nacional
we believe that as
de
a
tal
national
forma
government,
que
we'll be
la que
able
la salud pueda
to
llegar
comply with our
a todos
commitments
los paraguayos y paraguayas
and
y que las
bring
distancias no sean una limitante
bring
social para el
healthcare to
acceso
all
universal a la salud.
Paraguayans, and
Estamos trabajando
that
y seguiremos
so that
trabajando y con la inauguración de
the
estas unidades de
financial
salud
level
estamos
is
ya
not
esperando
an
desde el Ministerio
obstacle
de
for
Salud y desde el
obtaining
gobierno
healthcare.
nacional mismo
And this is
mantener
these are the
firme los
goals of
preceptos
the
avanzados
Ministry of
de la
Health and
conferencia en aquel
the
septiembre de
national government.
1978
And
Alma Ata. Muchísimas
we
gracias.
would like to
Gracias
comply
a los
with the
tres por sus
objectives of the
comentarios y por
ALMA
sus
at
bases
the
a esta iniciativa.
conference, 1978. Thank you
Muchísimas
very much.
gracias,
Thank you
a los panelistas.
to the panelists. We are
problemas
sorry
con la conexión con la
that
doctora
we
Morales.
had problems
Gracias,
with
doctor
our
Eduardo,
connection with Dr. Morales. And I want to thank Dr. Alvaro and our colleagues from Paraguay. Thank you, Wilson. And before going to the conclusions and the closing of this seminar, I want to say that the recordings of this seminar and all the other documents will be at the PAO website, as Ernesto said at the beginning, and we will share the link in the chat. And so in order to finalize our discussion, we would like to hand over the floor to Dr. Fitzgerald from PAO. Thank you, James. Thank you, Claudia. It was an excellent session, and thank you for conducting this event. Thank you to Julio and Ernesto and all the other participants, and all of you that provided logistical support also. Thanking all the participants. We have more than 500 people connected today, and well, they are sharing their opinions and their presentations also. And I believe that highlighting these common points in the presentations was very important. The two reports we have shared today, the analysis of the performance, budget performance in the health sector, and the expenditure for primary health care in Peru, leaves us with some lessons learned. There is good news. Despite the economic problems during 2021 and 2020, we perceive that there is an improvement in health budgets and health care. So it is
Incluso cuando
possible
existen
to achieve
restricciones presupuestarias y
an
escenarios
improvement in
macroeconómicos
healthcare
en
even
el
during
contexto
macroeconomic
práctico.
bad
El caso
times.
de Perú
In the
es
case of Peru,
particularmente interesante, pues
this is
hizo
particularly
frente a un
interesting
alto nivel
because
de
Peru
interrupción de
faced
servicios que hemos visto,
faced
con
a
también una
high
aceleración de la
deficiency of
inversión en estas
services
unidades de atención.
and
En segundo
uh,
lugar, la capacidad de
and
innovación
less
generada en un momento tan crítico
investment.
que hemos
But
pasado en el
during the
país, ¿no?
critical times and
Ella
during
se
those
hizo
years,
evidente con la creación de programas
this
presupuestarios para la
improvement
respuesta sanitaria y
became
la emergencia,
evident through
y
the
además con la
creation of
creación de fondos
programs
especiales
for
o
facing
transitorios,
the
que son
emergency
estos objetivos
situations.
muy importantes en este
And
contexto.
these are objectives
Quería
that are
también
very
agradecer a
important in this
Sebastián y
context.
Cristian, nuestros
I also
colegas del
wanted
IDB y el
to
Banco
thank
Mundial,
Sebastian and Christian
para realmente
from
destacar las
the IDB
oportunidades de
and
trabajo conjunto entre
World
nuestras
Bank for
instituciones
their
dentro del marco de
joint
la Alianza
support
para la Atención Primaria de
in
Salud.
this
Es un
Alliance for
mecanismo
Primary
que
Health
va a
Care.
permitirnos
This is a
avanzar en
mechanism
una
that will
agenda
allow us to
conjunta
make
de
progress in a
transformaciones y
joint
fortalecimiento del
agenda
sistema de
of
salud basado en
changes
las
and
TS.
strengthening the
Como
health
ustedes bien
budget.
mencionaron, con
And
enfoque
as you
territorial,
mentioned,
con enfoque
this
de
is done with a
combinando la necesidad de la
territorial,
población,
with a
tomando
regional
en cuenta
focus,
cada contexto y
taking
las
into
condiciones de
account
las poblaciones
each
y sus
context and
necesidades.
the needs of the
El
population
análisis y el desarrollo de
and
mecanismos de
their
pago en los
situation.
medios de atención
And
más
this
contextualizada es
primary
obviamente una
health
prioridad
care
para nuestras
is a
organizaciones.
priority for
Y con la
organizations.
colaboración de nuestros socios
And
seguimos acumulando
together with our
evidencia
partners,
clara
we're still
de que
accumulating
realmente es necesaria
clear
implementar la
evidence that
inversión
it is
pública
important
en sistemas de salud
to
resilientes.
increase
Y esta
public
inversión puede ser
investment in
debería
resilient
ser
healthcare.
efectivo
And
y
this should be
resultar en
cost
mejoras en
efficient
el
and
acceso y en
result
mayor
in
protección financiera
improvements
de los
and
hogares y de las
service
familias.
and financial protections of
No
the
puede dejar de
families.
resaltar la experiencia de
And
los
we would
países.
like to
Realmente
point out the
agradecimiento
experiences
al
of the
representante de
countries.
Paraguay,
I
Honduras y
want to
Chile.
thank the
Nos
representatives
llevan a
of
reflexionar que no
Paraguay
hay
and
una única
Chile
solución
and
para hacer operativos
Uruguay
los incrementos de
that
inversión en la
show us that
OPS
there is not only
y que el
one
contexto y la organización
possibility
del
of
conocimiento y la
solving
prestación de
problems,
servicios será
and
el
that
determinante central del
services
aprendizaje de
can
cada
be
uno de los
improved
países. Tenemos
through
que
different
conseguir
processes,
continuar
as was seen in the
generando
different
evidencia
countries.
sobre estas buenas
We
prácticas
should
en los países.
continue generating
Y estos
evidence about
desafíos de
these good
asignación y
practices in the
utilización efectiva de
countries,
los recursos
and
financieros
these
merecen
challenges of assignment
mayor
of
indagación
financial
todavía.
resources merits
A
further
ello debemos
analysis.
sumarle también la mirada sistémica y es realmente un punto
And
muy
this is the
importante.
word, the
Integrar
concept of
esta información con
systemic
otras que hemos
service
recabado sobre la
is
etapa de
very
enfrentamiento de
important
la pandemia.
because we,
La interrupción de los servicios
the
esenciales
services were
y el incremento de las décadas, el análisis de
interrupted in
listas
many
y tiempos
cases
de
during
espera
the
y
pandemic.
sobre todo
Waiting
cuál es la
times were
necesidad de
increased,
financiamiento y cuáles
but
son los incentivos
what
para
is the
superar
relationship
estos
between
desafíos.
financing and the
Finalmente, un
challenges
punto
to overcome
realmente
these
de
challenges,
alta
the
importancia para esta
challenges to overcome these
conversación.
efficiencies?
Es fundamental para
And
los sistemas de
it's
salud contar
fundamental
con
for
una
healthcare
estrategia de
systems to have
afiliación
a
fortalecida
strategy
que ponga
that
en el
is
centro a las
strengthened
personas
and that
y
is
que
focused on
responda de
people
manera integral
and
e integrada a las necesidades
responds
diferenciadas de
to
la población
the
de
care
su,
and
de su
attention
entorno y
needs
de
of the
sus territorios.
population
Este
and
es realmente
their
un legado más
surroundings in
que
the
relevante
different
para este ciclo de décadas.
territories.
En fin, realmente quería
And
agradecerles
I
todo.
wanted to thank you
Vuelvo a
again.
invitarles a
I
descargar
want to
los
invite you
informes,
again
el informe que
to
hemos publicado hoy
download the
y
reports
compartirlo con
published
quienes
today
pueden estar
and
interesados en
share
este
them
trabajo.
with those that
Muchas
could be
gracias.
interested in them in your
Muchísimas gracias, James,
workplace.
y muy
Thank
buenas
you.
tardes
Thank you,
a
James, and good
todos.
afternoon to you all.
Tengan un buen resto de la semana.
Muchas
And we wish
gracias.
you a
Hasta
good
luego.
week.
Chao, chao.
Thank you. Goodbye.
Gracias.
Muchas gracias.